Hey everyone, welcome back to my channel Medico's Guide. This is Dr. Ida Khan and today we'll be talking about allergic rhinitis. Let's start by understanding the term rhinitis. The word comes from Greek rhino means nose and iris means inflammation. So, rhinitis is simply inflammation of the nasal lining. But what makes it allergic? It's your immune system overreacting to harmless allergens like pollen or dust. Allergic rhinitis is a type of nasal allergy. You might know it as hay fever, but it's not always seasonal. The symptoms are frequent bouts of sneezing, runny nose, and red, itchy, swollen eyes. It happens because your immune system is working overtime in response to triggers. This condition is incredibly common. Around 10 to 30% of the global population is affected, especially children and young adults. For some, it's seasonal and flares up in spring or fall. For others, it persists year round due to indoor allergens like dust mites or pet dander. So, what triggers these symptoms? Common allergens include pollen, mold, animal dander, and dust mites. If you have a family history of allergies, asthma, or eczema, your risk is higher. And environmental factors like smoke or strong odors can make it worse. There are two main types of allergic rhinitis: seasonal allergic rhinitis, in which symptoms peak during specific seasons, and this is triggered by outdoor allergens like pollen. Then the next one is perennial allergic rhinitis, and this is caused by year round indoor allergens like dust mites and pet dander. And let's not forget about occupational rhinitis, which is triggered by allergens at work like chemicals or dust. Now let's dive into pathogenesis. Allergic rhinitis is a type 1 hypersensitivity reaction. Let's break down what happens in this reaction. When you are exposed to an allergen, your immune system tags it as harmful during the sensitization phase. So, in initial exposure, when someone with AR is exposed to an allergen, their body produces allergen specific immunoglobulin E, which are IgE antibodies. These antibodies bind to IgE receptors in mast cells and basophils. Next time you are exposed, mast cells in your nose release histamine, causing sneezing, congestion, and itching. So, in early phase reaction, when same allergen is inhaled again, the IgE antibodies bridge the mast cells and basophils, causing them to release chemical mediators like histamine, prostaglandins, and leukotrienes. These mediators cause the immediate symptoms of AR such as sneezing, rhinorrhea, and itchy red watery eyes. In the late phase, your immune system causes chronic inflammation, making symptoms linger. Now let's talk about diagnosis or investigation. Allergic rhinitis is diagnosed based on your symptoms, family history, and physical exams. Skin prick testing or blood tests for IgE levels help confirm allergies. Imaging, like sinus x rays, is used if there's a structural concern. There's a good news. With right treatment, symptoms are manageable, and most people lead normal, healthy lives. However, untreated allergies can worsen and lead to complications like chronic sinusitis or asthma flare ups. Management Management includes four key strategies: allergen avoidance, reduce your exposure to triggers. Then, medications. Here we have antihistamines like loratadine or cetirizine. They block histamine H1 receptors to reduce symptoms. The nasal steroids like fluticasone, budesonide reduce inflammation and nasal congestion. Decongestants like pseudoephedrine or oxymetazoline relieve nasal congestion. The leukotriene receptor antagonist like montelukast reduces airway inflammation. And then mast cell stabilizers like cromolyn sodium prevents mediator release from mast cells. Immunotherapy, here the allergy shots or tablets build tolerance to allergens. And then the surgery is rarely indicated for structural issues like a deviated septum. Let's now talk about complications. So, untreated allergic rhinitis can cause chronic sinusitis, otitis media, sleep disturbances, and asthma exacerbations. Now, prevention. Preventing allergic rhinitis is all about minimizing exposure to allergens. Air purifiers, keep your living spaces clean, and avoid triggers when possible. It's simple steps like these that make a big difference. Let's get an overview. Allergic rhinitis is a prevalent condition that significantly impacts quality of life. It is manageable with proper treatment. It's a type 1 hypersensitivity reaction caused by pollen, mold, dust mites, and animal dander. The best way to manage it is to minimize allergen exposure. That wraps up today's video. Don't forget to like, share, and subscribe for more medical insights. Comment down below more topics you want me to make videos on, and thanks for watching.